Bismillahirrahmanirrahim. Assalamu alaikum. Today I welcome all my students of second year MBBS and BDS to today's lecture regarding the hyperpituitarism. Now, what is it? How the pituitary gland hypersecretes. Now, most of the time, as you know, that 30-40% cells of the anterior pituitary gland, they are composed of eosinophilic cells, which are the growth hormone producing cells. And God forbid if there is any acidophilic tumor that is secreting the growth hormone and prolactin in excess during the course of childhood before adolescence, it can give rise to a disease known as gigantism. Now, what happened is that in gigantism, there is increased growth hormone before adolescence, that is, increased growth hormone before union of epiphysis with shaft in long bones, so the length of bone increases very much. And the height of the individual can increase up to 8 to 9 feet. Later, hyperpituitarism occurs in those patients because pituitary tumor destroys the tissue of the pituitary. Acidophilic growth hormone producing cells of the anterior pituitary gland become excessively active and acidophilic tumors occur in the gland. As a result, the large quantities of growth hormone are produced. All body tissues they grow rapidly, including the bones. If the condition occurs before adolescence, before the epiphyses of the long bones, they have become fused with the shafts, height increases so that the person becomes a giant up to 8 feet tall. The giant ordinarily has persistent hyperglycemia. Beta cells of the iles of Langerhans in the pancreas, they are prone to degenerate because they become overactive owing to hyperglycemia. In about 10% of giants, full-blown diabetes mellitus develops. Other features of gigantism, they are like osteoarthritis, diabetes mellitus, lactation without pregnancy because of prolactin releasing hormone, um, excess, the local effects of tumor, they are like because of the raised intraocular pressure, there is headache, visual disturbances, there is bitemporal hemianopia. See, gigantic. Uh, the facial features, gigantism. See, in gigantism, there is increase in the height, like more than 6.5 feet even, and there is excessive linear growth, and there is increase in the soft tissues as well. There is greatly large hands and feet size, and there is general enlargement of the visceral organs. There is cardiomegaly there too. There is deep hollow sounding voice. The facial features, they are coarse as well. Panhypopituitarism eventually develops if they remain untreated because the gigantism is usually caused by a tumor of the pituitary gland which grows until the gland itself is destroyed. This eventual general deficiency of pituitary hormones usually causes death in the early adulthood. However, once gigantism is diagnosed, further effects can often be blocked by the treatment. And what is that? That is in microsurgical removal of the tumor or by irradiation of the pituitary gland. Hyperpituitarism during adulthood acromegaly. If an acidophilic tumor occurs after adolescence, after the epiphyses of the long bones have fused with the shafts, the person cannot grow taller, but the bones they can become thicker and soft. Tissues can continue to grow. Excessive growth hormone after adolescence when epiphyses of long bones is united with shafts. There is enlargement of the peripheral parts. Enlargement is especially marked in the bones of the hands and feet and in the membranous bones, including the cranium, nose, bosses on the forehead, supraorbital ridges, lower jaw bone, and portions of the vertebrae, because their growth does not cease at adolescence. Clinical features in acromegaly is that there is protruding forward of the jaw. The lower jaw protruded forward, given the name of prognathism or lantern jaw, and sometimes as much as half an inch protrusion that is there. In the forehead, there is supraorbital ridges. They slant forward because of the excessive development of supraorbital ridges. Nose increases to as much as twice the normal size. Feet require size 14 or larger shoes. Fingers, they become extremely thickened so that the hands, they're almost twice normal size. Changes in the vertebrae, they cause a hunched back, which is known clinically as kyphosis. Many soft tissue organs, such as the tongue, the liver, and kidneys, they become greatly enlarged. Some of these individuals, they can develop diabetes mellitus, lactation in ladies without pregnancy that is seen. C. The hands excessively enlarged in size. C. There is prognathism, lantern jaw, there is protrusion of the supraorbital ridges, there is large size ears, nose size has been increased, coarse facial features they are there. C. The feet. Now, the local effects, they can be like headache, visual disturbances, bitemporal hemianopia, enlargement of soft tissues. Typically, an acromegalic patient resembles the gorilla, hands reaching the knees because they are so very much enlarged. There's hunchback due to kyphosis, there's prognathism. The principal findings in acromegaly are those related to the local effects, and there is enlargement of hands and feet, acral parts, hence the term acromegaly has been given to it. Prognathism, that is protrusion of lower jaw. Now, overgrowth of the frontal and facial bones combines with prognathism to produce the coarse facial features, given the word acromegalic facies. Now, what is this word facies? Facies is the facial appearance of a person. Body hair increase in size, hyperhidrosis that is there. The skeletal changes predisposed to osteoarthritis. Above about 25% they have abnormal glucose tolerance test, and 4% of the cases they do develop lactation even in the absence of pregnancy. See how the acromegaly changes the face of a person with time. See large supraorbital ridges, visual disturbances, large nose, prognathism, cardiomegaly, pancreas leading to abnormal glucose tolerance test, greatly enlarged acral endings, which are the hand, the feet, visual disturbances, bitemporal hemianopia, osteoarthritic vertebral changes, prognathism, acromegalic facies, hirsutism, gynecomastia, lactation, enlarged hands, feet, the feedback control mechanism of the growth hormone. C. Somatostatin growth hormone releasing hormone from the hypothalamus, they are going to affect on the pituitary gland, which is going to act on the liver to release the insulin like growth factor 1, which are having the effect on the tissues and indirectly affecting growth hormone release from interior pituitary, as well as um, via blood reaching the hypothalamus to release somatostatin to decrease this process. Now, the role of decreased growth hormone in causing changes associated with aging. What happens is that during the course of aging, there is a decrease in the protein deposition in most of the tissues, and there is increase in the fat deposition. The physical and physiological effects, they are the increased wrinkling, diminished rates of function, and diminished muscle mass and strength. See, with age, the secretion of growth hormone decreases. Like 5 to 20 years, there is 6 nanogram per ml, and by the time the person is above 40, it decreases to 1.6 nanogram per ml. Now, the treatment with the human growth hormone, the growth hormone of human being is called human growth hormone to distinguish it from others, and can now be synthesized by E. coli bacteria as a result of successful application of recombinant DNA technology. In fact, there's some studies of the growth hormone therapy in older people. They have demonstrated three beneficial points, which are like increased protein deposition in muscles, a feeling of increased energy, decreasing fat deposits, and the side effects they have been seen like insulin resistance, diabetes, edema, carpal tunnel syndrome, arthralgias. Therefore, this therapy is generally not recommended for use in healthy elderly patients with normal endocrinal functions. So, this is all about the growth hormone um, diseases and today's lecture. So stay tuned, uh, go through this topic thoroughly, and stay blessed. Allah Hafiz.